Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Myself, Dr. Rajesh Choudhary. I am an ENT surgeon and medical director of Choudhary ENT Hospital, Amritsar. My topic is regarding diagnosis of vertigo. When someone walks in with vertigo, what should a proper evaluation look like? The first step is always a conversation. I usually ask, when dizziness start? What does it feel like? How long does it last? And what brings it on? And also, there are hearing changes, ringing in the ears, headaches, or any other symptom. That history alone often gives us most of the answer. Some question related to this is everything starts with scan and machines. Exactly in vertigo, the story is often more important than the test. First, the next comes after the history. A physical examination, one of the most important things we look at in the eyes. There is a movement called nystagmus. That is involuntary eye movement. The way the eyes move can tell us whether the problem is coming from the inner ear or from the brain. That helps guide everything else. Patients often hear about something Dick's Helping test. What exactly is that? Basically, Dick's Helping test is to diagnose benign paroxysmal positional vertigo. In this test, we turn the head, quickly lie the patient back, and watch the symptom and eye movements. If it positive, it means patient feels vertigo and we see a specific eye movement pattern. The important part is it doesn't just diagnose the problem, it also tells us which ear is affected. So we can treat immediately with repositioning exercise like apple maneuver. In some cases, diagnosis and treatment can happen in the same visit. Exactly, which is very reassuring the patients. What about most advanced tests like VHIT? Basically, VHIT is a video head impulse test. It's quick and very patient friendly. The patient wears goggles that track eye movements. We gently move the head in different directions. In a healthy system, the eyes stay fixed on a target. If there is a problem, the eyes make a small corrective movement. This helps us identify which part of the balance system is not working well. And does that replace the other tests? Not completely. It works alongside other tests like calorie testing because each test looks at different parts of the system. What does a more detailed balance assessment involvement? One common test that is VNG. VNG means video nystagmography that record eye movements in different situation. It uses goggles to track eye movements in different situations. We also do caloric testing, where warm water or cool water is used to gently stimulate each ear and compare it and how they respond. Another test is VAMP. VAMP is vestibular evoked myogenic potential, which looks at different part of balance system, especially the structure that help detect gravity and movements. So different tests looks at different parts of balance. Exactly. That's why sometimes more than one test is needed. When does imaging like MRI come into a picture? Not for everyone. For example, we don't need MRI for typical BPPV. We think about imaging when symptoms don't fit the usual pattern, there are neurological warning signs, or there is hearing loss on one side. In those cases, MRI helps us rule out central causes like tumor or stroke related issues. And the type of scan matters too, right? Very much. For balance and hearing problems, the scan needs to focus on specific areas like the inner ear and brainstem. Otherwise, small issue can be missed. For someone who have already seen multiple doctors but still doesn't have answer, what would you suggest? I would suggest consulting a specialist with experience in balance and disorders, like neurologist, an ENT with vestibular expertise, or a specialized vestibular clinic. And also keep a simple symptom diary. Write down what it happens, how long it lasts, and what triggered it. That kind of details can really speed up the diagnosis. Before we wrap up, there are three key takeaways. One, a detailed history is one of the most powerful tools in diagnosing vertigo. Simple bedside test like that I spoken earlier, Dick's helping that can diagnose and guide treatment. If answers are not clear, a specialist assessment and right test can make all the difference. And most importantly, the process may feel confusing, but there is a structured way to figure this out. Final message, vertigo can feel confusing, but there is a structured way to diagnose it. Thanks a lot.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.